How about this? So just chill right there. I'll go.
Maybe I should.
All right. We just finished the massage session. Julian, Connmar, Julian, how are you feeling?
Like crap.
Feeling like crap. All right.
I'm teasing. No, I'm feeling great. It was a great session. My back needed. I had this mid back area that was the worst, and that needed the most. I was like most reactive to that, and then there was. Let's see. Shoulders, upper back, mid back, lower back too. All that just needed it. It was just a day where I needed the back work done. That was the whole thing.
Had a lot of buildup in the back that needed to get released.
Yeah. I described it when I was on the table. It was like you were wrestling a gator. Mm-hmm. You were trying to instruct me, and I was trying, but the muscles didn't want to go with anything because they were just tense and sore. Right. So that was a great massage.
So it isn't easy to be an easy client to work with if you really think about it. Then, especially having areas that are real like beat up, tense, sore, tight, knotted.
You're saying it isn't easy to be an easy client to work with? Is that what you're saying?
Yeah.
That's an interesting way to say it. The thought, one thing that really got my attention was I effortlessly thought of feeling as though I was in a hospital for like some kind of emergency intervention. Like I had been in the ambulance or some shit like that. Like
emergency
excuse
room.
my language. Like I had been like finally like I had the accident, and then I needed the fix.
Right.
Like, you know, the accident.
The emergency therapy.
The injury. You had the injury that required you to go into the hospital, and you needed the surgery or something. It was a notable feeling of feeling like I kept using the term doctor, but then it was like then we got into our debate about the doctor versus a massage therapist. But it was a feeling like the intervention surgery or some weird shit. It was a weird feeling to me, and maybe I've been watching too much Grey's Anatomy, which is all about surgery, but my mind did go there. Like, I was a patient. That's it, like a patient. Even more than a client, like a patient. That was really cool.
Oh, wow.
That was an interesting feeling for me, to effortlessly go there without even trying to go there. But once again, I'm a massage therapist too, and my back gets messed up because I'm always doing these massages, so I'm always doing this stuff.
You're leaning over the table.
I'm imagining too, like Jovi, like for example, when you work on crazy clients who have like crazy tension from the jobs they do or whatever, they're going to have bigger reactions and they're going to be more difficult. Their muscles are going to be more difficult. So I definitely felt like I was in that league of trouble there. Like trouble, yeah, like I had trouble areas. I love that mid back on the left side. That was so cool. That was special. I don't think I've ever had that worked on in the depth and the focus that you did that time. So that was the first. That was a first. Yeah. I don't think I've ever had someone do that to that magnitude, ever.
So that has been a chronic pain that you've had.
Yes, that's right.
Long-term chronic pain.
Since the mid-2000s, like 2005. That was cool.
So right now, if you turn and twist,
see what it feels like?
Yeah, you gotta try it out.
I would say...
You're so used to being like uptight and compressed, so now you're like nice and loose and goose. Your face looked like it went through a facial cleansing. For real, it really does look that much clearer and leaner.
Yeah.
Should get some headshots right now.
I'm definitely... I remember when I got up off the table, I remember feeling like I had the dope look on my face, like I was dopey. Like I was like, oh, like I woke up from a slumber or some weird shit like that, like I had been through the procedure.
Definitely.
The intervention procedure to fix my brokenness or some weird shit. It was so cool, man. So professional. I was really impressed. I was like, man, you're so good. I was like using bad words to describe how good that was, but that was great.
Yes, sir. Well, thank you for coming down, being a great client, patient. You know, there's a lot of room for improvement. You can see that your body needs a lot more work. Even as a therapist, we kind of neglect ourselves, but you know, maybe a better idea to just, you know, leave our worries and stresses behind, tell the client what we need, and just trust in their therapeutic approach and see what kind of results we get out of it.
Yeah, and you do get a change. It is slightly perspective changing when you get work done by someone who really knows the specifics, like on the magnitude that you got the specifics. So that's great too. Thank you, Jovi. Peace.